In the last week, we've been contacted by hundreds of people, laying bare the human cost of a health system in crisis. Patients left soaked in their own urine, unable to sleep under fluorescent lights. Simply hopeless scenes.
I felt awful, absolutely awful. I was shutting my eyes, trying to shut it all out.
76-year-old Lynn went into A&E in pain, vomiting and shaking, but was met with a horror show.
There's the blood on the floor.
She had to wait 10 hours on a chair in the waiting room, then 16 hours on a trolley waiting for a bed.
The noise of people shouting and coughing and in pain. It made me want to cry for everybody there, because it just was an awful situation to be in.
Arrow Park Hospital on the Wirral has apologised to Lynn, saying staff are working exceptionally hard during an extremely busy time. The latest data shows that's true across England. More than 2,600 patients a day were in hospital with flu last week, the highest ever for this time of year. More than 2.3 million people went into A&E last month, a record for November. The number of them who waited more than 12 hours for a bed stood at more than 50,000. That's around 5,000 more than this time last year. And for those calling ambulances for things like a stroke, the average response time was more than 32 minutes, well over the long-standing target of 18 minutes.
We're letting them down at every single step of the way.
Mark knows the pressures firsthand. He's a paramedic and contacted ITV News to speak out about the reality on the front line.
What's it like for you going to work at the moment?
I feel physically sick. I don't want to go to work because I know for a fact that the next 12 hours are going to be absolutely horrendous. You know, the public are going to be let down.
Are you having to leave patients in corridors to be cared for?
Yes.
How does that feel?
We shouldn't be leaving anybody in the corridor. There's no respect for the patient there, there's no dignity, there's no confidentiality. We've had people who've been suffering with strokes, who've been left in the back of ambulances for hours.
What impact is all this having on you?
Me, personally, I'm starting to suffer with anxiety.
On a visit to Norfolk today, the Prime Minister responded to our reporting.
Well, these are very concerning. We absolutely need to bear down on that. Nobody wants to see those conditions or patients dealt with in that way. We have invested hugely in the NHS, the biggest investment in the budget that's ever been put into the NHS. The NHS was brought pretty much to its knees by the last government. We are turning that around.
But turning this around is clearly taking time, increasing the risk of it becoming the norm. Rebecca Barry, ITV News.
Well, the surge in cases is being fuelled by new mutations of the flu virus. Our science correspondent Martin Stew is here. Martin, people very often, don't they, get ill at this time of year, but how much worse is this set of viruses than usual?
Well, we saw that headline figure in Rebecca's report, 2,660 cases of flu in England. Let's try and put that into some form of context. So it is the highest that we have seen at any time, this time of year at all. It is also, a real worry. Excuse me 1 second. Sorry, we'll just have a small technical problem in the studio. It's also 55% increase on what we saw last week, which was also a record. And to think of that another way, it's enough for patients to fill three beds in 3 whole hospital trusts. A lot of it is to do with a strain of flu we had this year, which is called H3N2 subclade K. Scientists in the UK Health Security Agency have been tracking that as the strain has become dominant and now accounts for 90% of cases.
The H3N2 viruses, they do cause people to have disease. They cause hospitalisations, particularly in some of those more elderly age groups, but there's no indication that this particular subclade of H3N2 is more deadly than what we've seen before.
So the risk really is that the transmissibility, how easy it is to pass on?
Yes, so the strain does appear to be more transmissible.
And the big question is then, is the vaccine working against that new strain? Well, early data suggests, yes, it does. Amongst children, vaccination is estimated to cut the chances of being hospitalised by around 70 to 75%. In adults, it's lower at 30 to 40% reduction, but that's similar levels of protection to that we've seen in previous years. In terms of uptake, if we look at the risk groups who are entitled to a free jab, more than 70% of people 65 and over have been vaccinated, which is above previous years, but rates amongst people with underlying health conditions, and as you can see at the bottom, pregnant women are significantly lower, and people in those groups particularly are being encouraged to get vaccinated. Now, it's worth noting it can take 14 days for protection to kick in, even after a jab. Then you can still get ill. The chances are, though, Mary, your symptoms should be milder and you should recover quicker. In terms of masks, it's not mandatory other than in some hospitals, but if you're feeling unwell, it might be a sensible thing to do to wear one.
OK, Martin, thank you for that. Well, Scotland's flu cases are up by almost a quarter in the past week. It's also much higher than usual for this time of the year. Health authorities there are looking at introducing mandatory mask wearing in hospitals to help tackle the spread of the virus. Our Scotland reporter Vanessa Taff is at GP surgery in Glasgow, where they are really feeling the increased demand. So, Vanessa, tell us, how are they coping there?
Well, for many of us, the front line here is the GP surgery when we're feeling unwell. And they are coping here, but they're very worried about this rising number and what's to come. They're asking people when they come in, consider please to wear a mask. Get to know the symptoms and protect yourself and your loved ones as we come into this festive period. Now, the Scottish Government just this afternoon met for a resilience meeting to see how they can cope with this rising number of flu to help the NHS. But most concerningly with these flu cases, the so-called super flu variant is how it's affecting young people, particularly those school-aged children. And I'm joined now by GP Dr. DePali. Is that something you're seeing here, rising number of young people being unwell?
Concerningly, it is actually. I'm seeing about 30 to 40% more children than we'd normally see. A lot of them are school age and younger. So I'm seeing quite a few under twos whose siblings are at school and at nursery. Yeah, they're presenting with quite serious respiratory illnesses.
And why is it that they're becoming more unwell, say, compared to some of the adult patients you're seeing?
I think it's because the advice we give to adults, for example, cover your mouth with tissues. Children don't do that. Children share food, children share toys. Some of the younger babies we're seeing, they're too young to have been vaccinated, and so they're picking up bugs from their siblings that have been vaccinated.
And there's going to be lots of Christmas nights out as well. Just quickly, how concerning is that for being super spreader events this weekend?
Well, it is concerning. So the advice would be to follow, good advice. If you have any mild coughs, colds, sneezing, please stop. Don't go out, even though, that's quite sad that you might miss out. Use cough, sneeze into tissues, bin the tissues. Don't touch your mouth and nose and eyes where germs can spread.
Great advice there. Well, if you are heading out this weekend, the advice is very clear, and there is still time to get vaccinated ahead of that Christmas festive period.
OK, Vanessa Taff in Glasgow, thank you. Well, our health correspondent Rebecca Barry is here. I mean, it really seems like the NHS is under extreme pressure, isn't it?
Yeah, it is. And at this time of year, when the winter season and the busy flu season gets underway, I go into hospitals and we film. But I've been really struck by the photos, the videos, the stories that we've received from members of the public, which I think give a really raw insight into the reality on the front line, not just for patients, but for staff. That paramedic that I spoke to in my report, he said he dreads going into work. I think that gives an insight into the psychological impact of all this on staff, let alone the potential physical harm for patients, of course. Look, today's data shows that the busy winter season has hit the NHS early. But if you ask anyone in the health sector, they will tell you that these high rates of flu are only exacerbating the existing pressures which the NHS now contends with year round. And then, of course, we've still got the potential threat of a strike by doctors next week. We find out on Monday if that goes ahead. But by then, some patients will already have had their operations cancelled. Staff will be making contingency plans. And all this in the midst of an unprecedented flu season.